If you have Medicare, and this includes both Original Medicare and Medicare Advantage health plans, you have rights. Acentra Health is the beneficiary and family-centered care quality improvement organization for the 29 states highlighted on this map. Acentra Health helps people with Medicare file complaints about the quality of healthcare services they have received and make requests to appeal a hospital discharge, observation status, admission hospital-issued notices of non-coverage, or the stopping of skilled services such as physical therapy. We also offer immediate advocacy services when issues need to be taken care of right away. This video explains our immediate advocacy services. It can be used when people need to quickly fix an issue with their medical care or services. Please note that immediate advocacy is not a medical record review, but a verbal interaction to attempt to assist the person with Medicare. Here are a few examples of when immediate advocacy may help. My mom is in a hospital. I'm her caregiver and have asked the hospital staff about her plan of care. I can't get any answers. Immediate advocacy services can be useful if patients and their families can't get all of their questions answered. I'm waiting for my wheelchair to be delivered. I called the medical equipment company and there is a problem with delivery, but they can't seem to help me solve the problem. Immediate advocacy services can be useful when you can't get your issue taken care of, even after talking with your medical equipment company. I need to refill a prescription, but when I went to pick it up at the pharmacy, there was a problem. It couldn't be refilled, and I can't get in to see my doctor. Immediate advocacy services can be useful when you are having problems getting your prescription refilled. Those are just a few examples of when you may want to call Acentra Health and ask about immediate advocacy services. Now let's take a look at how the immediate advocacy process works. The process goes through 3 basic steps. Step 1. Call Acentra Health. If you can't call someone else, such as a friend or family member can call for you. Step 2. The process begins when you are on the phone with Acentra Health and you agree to immediate advocacy. Step 3. Acentra Health will contact the healthcare provider on your behalf to help solve your problem. This is usually done by phone. Everyone involved, the patient and the provider, have to agree to the process for it to move forward. Most problems can be taken care of in 1 to 2 days. Even after you start the immediate advocacy process, you can change your mind. The process may be stopped at any time. If you decide to stop the process, Acentra Health will let you know about your right to file a written quality of care complaint. Let's take a look at a couple of real-life examples. A Medicare patient called Acentra Health because his insurance plan would not pay for an eye exam. He had a visit with his primary doctor and told the doctor that his right eye was blurry. The doctor thought he might have a cataract and sent him to an eye doctor for follow-up. But the staff at the eye doctor's office said that the insurance would not pay for the visit. The patient called Acentra Health and asked about immediate advocacy. Acentra Health staff set up a call with the patient and a customer service rep from the insurance company. The insurance company said that the eye doctor was not on the company's preferred provider list. She gave the patient the name of an eye doctor from the company's preferred provider list and also called that doctor's office to be sure that the office took the insurance plan. After the patient had the new doctor's information, he said that he would get a new referral from his primary doctor's office. The patient was happy that Acentra Health was able to solve the problem. Here is another real-life example of how the immediate advocacy process works. A Medicare patient's daughter called Acentra Health. Her father was in the hospital and had a fever for the last 3 days. She had not been able to meet with the doctor and was concerned that she didn't get information about her father's plan of care. The patient's daughter asked about immediate advocacy services. Acentra Health staff set up a phone call between the patient relations department at the hospital and the patient's daughter. The daughter was able to share her concerns about the lack of communication. The patient relations coordinator at the hospital found out which doctor was assigned to her father and asked the doctor to call the patient's daughter. The daughter was able to speak with the doctor, share her concerns, and have her questions answered. Acentra Health was able to get the patient's daughter the information she needed. If this video was helpful, please subscribe. Click the notification bell and you'll get notified whenever we post a new video. Thanks for watching. If you have questions about Acentra Health or resources we have available for people with Medicare, visit acentraQIO.com/Benny. There are also useful links and more information in the YouTube video description.